while a lot of governments, so the NHS, the UK, where Ali you are investing heavily in primary healthcare, and they have always been. But this is not the case in many other places. Governments and investors and private sector still prefer the secondary and tertiary. So how do you even make, while they're not even investing in primary healthcare, the normal one, how do you even make the case for digitalization in primary healthcare?
So those who are not investing in healthcare are fundamentally wrong, in primary healthcare, are fundamentally wrong. And I think we are seeing more and more governments investing heavily in primary healthcare. As I said, I just saw the government of Saudi Arabia coming up with a significant RFP about reorganizing its healthcare to focus.
I'm working on it.
You're working on it. So
yeah.
you know. So this the idea that you could deliver healthcare without primary care is just fundamentally wrong. Because imagine I got a stomach pain. How do I know which kind of doctor should I go to? Do I go to a gastroenterologist? Do I go to a liver doctor, to a kidney doctor? Somebody needs to be my concierge, my entry into healthcare. So I think that we need to, this debate that you don't have primary care doesn't work. Patients need an advocate. And it's not about primary care or secondary care. It's about the model of healthcare, Yara. The existing model of healthcare basically says, get sick, we deal with your crisis. That is absurd. That is like waiting for you to starve and then feeding you and trying to deal with your dehydration and your lack of iron. And the right model of healthcare is to give so much healthcare upfront to people that they do not run to as little crises and emergencies as possible. And what we're arguing for is not really primary versus secondary, it's not really AI versus thing, it's not digital versus physical. It's actually about, let's just give people a lot of healthcare up front to avoid emergencies and expensive procedures downstream, right? And the only way we can park a doctor in every human being's house to give them a lot of healthcare up front is to use a lot of technology. That's right, if that makes sense. I'm going to keep the answers really short so you can ask as many questions.
Yeah. Well, thank you very much, Ali. Yeah, that makes perfect sense. And WHO has been advocating for primary healthcare since the 70s, since the Almata Declaration, and we were moving forward, but slowly. And as you were saying, the new slogan is actually leaving no one behind. So hope this gets picked up more. And the next question for Matthew. So with Google, Facebook, Apple, Amazon investing heavily in AI, how do you see this playing out in healthcare? So how do you see the entrance of these massive tech companies in digital health? How is this going to change the future of digital health, if they're actually going to make like a massive difference? Or so what do you think about that?
Well, I mean, they have to go there now because of their scale, just because of capitalism, right? It's such a big chunk of the American economy. It's $10 trillion worldwide. As Ali said, $3 trillion and change of that is in the US. So that's why Ali's in the US, is why they've got to do that. Now, what does that actually mean? The honest truth is no one really knows exactly where they're going. What are they good at? They're good at laterally taking stuff that they developed for their web and online businesses and their productions around their devices, and moving that to other areas. So they're going to be good at what they're good at. Google is going to be strong in the AI and storage area and moving that data into healthcare. And they're already supporting that with their cloud business. Microsoft will be too. Amazon is going to be good at the distribution and the management, the management of access to the consumer. You're going to see they've already started a small program initially for their highly paid office staff in Seattle. Now they've just extended it to their warehouse workers, who they've got a hell of a lot of those across the country, which is going to be a combination of telemedicine, drug delivery. They bought that company PillPack, behavioral health care, urgent care. They're basically building a primary care network because there isn't a good one in the US, and they're probably going to be rolling that out. Apple knows a lot about devices, right? Like this one, and they're adding that to the watch. They're adding, they're going with the sensors and this, that, and the other, which are going to be around measurement and a lot of that. They've bought companies in the areas, tiny companies in the area of asthma and diabetes and sleep and elsewhere, and they've also started accessing records. They bought a company in the accessing digital health records. space as well from providers. So they're all taking a somewhat different approach. I don't know what Facebook's going to do. I'm kind of concerned about them because they have been playing fast and loose with privacy for a while. But they're all going to come in. They're probably not going to come into the center of healthcare, although Amazon, by chipping away at primary care, might end up there. But they are certainly going to be using what they know and what they understand to improve, to allow other people who are going to be delivering healthcare to improve their stuff, so to improve their experience. So, Ali said, if you can find somebody who can do it better, they'll use that at Babylon. That will be common amongst many companies. And I'm sure there will be things that Google produce in terms of translation and AI and analytics and stuff like that, which get used commonly, as they are now, which gets used commonly. And there'll be areas where they particularly say, we're going to focus on this one thing, whether it's the brain behind the self-driving car, it's a way to do drug discovery in a better way. They have various assets across the board in health and outside of health. You'll see them all being used. I don't think we're going to replace the Mayo Clinic or United Health Group with Google. But, I didn't think Donald Trump was going to be president of America, so what do I know?